The maternal mortality rate is extremely high in Kenya. It hasn't really shown any improvement since the last census. It was around 488 deaths per 100,000 deliveries. That is absolutely unacceptable. And the basic causes of death are three issues. It is access, physical access, financial access. People do not afford maternity services. And the third one is social and cultural beliefs. A lot of people do not come to our facilities to deliver.
It's a situation that essentially means some portion of pregnant mothers in a population are lost to death. For every woman that's lost in death, there are another 10 who are injured in some sort of morbidity as a result of the inadequate access to these services.
Reproductive health is very critical because it has a bearing in all sectors. When you have to think about development in the wide perspective, you always must consider issues of human resource, and therefore reproductive health becomes very central in that.
The Reproductive Health Voucher program is a simple mechanism to bring healthcare services to women and men who are traditionally excluded or unable to access healthcare.
We have an overall weakness of the health system in giving family planning services, but also other services of reproductive health, for example, skilled attendance delivery, to the poor part of the population. So there was a huge problem of access, how to access the health structure when I'm a poor Kenyan. Normally I have to pay then out of my pocket for all services. I can't afford it. And that's why we thought, okay, what could be now a new approach to improve access of poor Kenyans to health facilities?
OBA stands for Output-Based Approach. This is a healthcare financing model that allows donor funds to be directed towards specific outputs. So unlike other models of aid, we pay for services that have been rendered and not for inputs as the previous models existed. The reason why the output-based aid approach is being piloted in this area is because it's been seen that the input-based aid approach does not necessarily result to improvement in quality of services.
So the whole idea is that we are able to see the results both at the facility level and within the community. We also see the output in terms of the goals that we have set forth, which is safe motherhood and family planning, and also dealing with gender violence and recovery.